Welcome to our education, real-world impact in IPF, how to make system-level changes. This is Dr. Evan Fernandez. I am an associate professor of the Department of Medicine and National Jewish Health in Denver, Colorado. In the following video, we will be discussing an educational initiative to improving the team-based care of patients with IPF. The National Jewish Health ILD program developed a quality improvement project with the following objective: to assess key performance indicators in the outpatient care of IPF, to develop a sustainable patient education tool in promoting a patient-centered IPF team-based approach, and to enhance the multidisciplinary team collaboration and patient-centered communication. Between 2016 and 2017, using the Plan, Do, Study, Act stepwise approach, first, the ILD team reviewed the current practices and processes related to the caring for patients with IPF and identify gaps and metrics to be addressed. During a second PDSA cycle, we developed and implemented an IPF patient education card to use in clinic and educated and trained the ILD team and staff on patient education strategies and on the process for documenting and tracking of key performance indicators. A metrics were prospectively followed and measured quarterly over 1 year in the ILD clinic with physicians individually and as an ILD group aggregate, and compared to a calendar year 2014 baseline. Part of the multidisciplinary team trainings and the learning included in interactive discussions, role-play simulation on face-to-face patient education, using an educational material checklist, self and peer assessment on what we were doing well or not in the documentation and tracking of metrics, and EMR documentation training. The IPF patient education activation card prompt discussions of key performance indicators between the patients and the ILD providers. In addition, we included 2 EMR order sets to help prioritize and consolidate the list of key performance indicators and all education classes available to IPF patients. ILD physicians were also provided with a dictated note upon completion of each visit, which served as a reminder to document actions taken with the IPF patient regarding the A metrics. The results show that providers' metrics improve over time in all areas measured. Provider survey demonstrated that the program motivated them to involve the ILD nurses more intentionally in the IPF patient visit and facilitated patient-centered education. The patient focus group analysis indicated that the patient activation card was considered helpful for understanding and managing the IPF diagnosis. Similarly, nurses focus groups feedback demonstrated the patient activation card was critical because it allowed them to continue important conversations at the appropriate time for the patient. The success of the QI IPF program was based on quality measures, not meeting a requirement. The program aims to real change, not just re-education. In conclusion, the initiative was successful in improving documentation of best care practices with IPF, and adjustments to the EMR to capture these elements supported sustainability. The initiative identified a need for a stronger role for trained nurses in furthering IPF patient education and underscored the importance of streamlining processes for the entire team to aid in improving implementation of best practices overall, and to providing take-away educational material to enhance patient-centered communication. Thank you for your participation in this important discussion.